live on Zoom and live on Facebook.
Welcome everyone to your COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. The November 3rd election is behind us, thank goodness, and the Electoral College votes for the president will take place on December 14th. Meanwhile, in the US, the latest figures show that someone dies every minute from COVID-19. So today we're going to talk about COVID and politics. Post-election, where are we now? Where do we stand? We've got a stellar panel for you as always. We have experts in health and politics, and we look forward to your questions. So I'm Council Member Jan Michelle Lemon-Kearney, and I am thrilled that co-hosting with me today is our superstar Tropicana from Radio 1. She might share with us a special phone call that she received from former President Barack Obama. We'll see if she'll talk about that a little bit later. We'll try to push her a little bit. First of all, let's give a shout out to our producers and tech team. We've got John Reichel and also Sloan Harris. So thank you both of you for making sure that all this technology runs smoothly on Zoom and Facebook. As a reminder to everyone, we are recording. We would like to post this town hall meeting later on the COVID-19 communityresources.com website. We'll also post it on other sites. So to all of our attendees, it's fine if you want to start now putting your questions in the chat room. If you're on Facebook or Q&A, if you're on Zoom, we're going to get to them soon, okay? So let me bring on Tropicana to introduce our wonderful panelists.
Good afternoon, everybody. Jan Michelle Lemon-Kearney, you know you are the superstar. I'm taking notes. Today we have a very amazing panel that I'm excited to talk to and learn some things from. First, we have Representative Emilia Sykes, our Ohio minority leader. Representative Sedrick Denson from the Fighting 33rd. Representative, is Ms. Ingram's on? Jan Michelle?
She is. Yes.
She is. Hi. Representative Catherine Ingram is on from the Great 32nd. Dr. Lou Edje from the Cincinnati Medical Association. My good friend, now he doesn't know we did a Zoom call not too long ago, so now we're cousins. Joe Mallory, NAACP President-elect. And of course, we have former State Representative Christy Coons with us today.
All right. Okay, so you know what? We're going to let each of our panelists give a quick intro, and then we're going to go to our Ohio Minority Leader, Emilia Sykes, to give us really an opening statement and set the stage for this conversation that we're going to have. All of you listening in, you can start already. There's a question in the chat room, so feel free to put in questions as all this is going on. Okay, why don't we I'll just call your names. Let's just start with Representative Denson. Representative Sedrick Denson from the Fighting 33rd.
Hello, everyone. It is good to be here today. Back on again, and happy that we're here with our minority leader to share with us. I'm from the 33rd House District. Things have been going well for us in this, what we're going into lame duck. It's been a bit hectic. Unfortunately, part of our topic today, talking about COVID, it hit someone in our household. So we are now at the end of our quarantine, and we all did not hurt each other. Thank God. we have really had to deal with it hands-on here. So it's been quite interesting seeing how politics have played a role in what COVID means and how we have the leverage to do some things from the state level. And I'm interested and looking forward to talking about that and hearing some of the questions from the audience. So thanks so much for having us.
Thank you, Representative Denson. I was going to say so many of our households have been touched by it. We either personally were touched by it or know someone who was. So it's really personal, I think, for everybody. So next we have Representative Catherine Ingram. Should we say from the Great 32nd? I don't know that we have a term.
No, that's Rep. Miranda uses that as the Great 38. I actually am in the shrewd 32 because all of my constituents are very shrewd and astute constituents as far as our politics are concerned. But right. Yes, the shrewd 32, Thank you for having us today. And of course, as Rep. Denson alluded to, we're in lame duck, and lame duck can get a little crazy. I got insulted on the floor the other day by one of my Republican colleagues, but we have to keep rolling and keep making them understand that we work for the people and we don't work for them. And so therefore, I was just on a call last night with Senator Laner, who is the chair of the Education Committee in the Senate, talking about some things that they're trying to move through and some amendments that they're trying to get done. And of course, this is all going to be crazy, and it gets crazier. I'm sure that the leader will talk about that shortly. But we also addressed, if you didn't know, Senate Bill 27, which was probably the craziest anti-abortion bill that just got passed off the House floor on Thursday. So these are things that we're hoping that they don't try to run over us with. And talking about COVID, there was also a bill that was passed out that says that the governor and the health professionals can no longer make decisions without bringing it back to JCAR in order to get some work. So and JCAR, of course, is a committee of folks from the legislature. And so we're just up against it. We just want to make sure that you understand that we do continue to work for you. So thanks very much for allowing me to be here today.
Thank you, Representative Ingram. We're going to come back and talk more about that. I have a lot of questions about all of that. But next, let's go to Dr. Lou Edje, here representing the Cincinnati Medical Association.
Hi there. I'm going to just start with 3 thank yous and then use a level setting statement and then talk about the perspective that I bring, the 3 different perspectives I bring to the table today. So first of all, thank you to Renee Mahaffey Harris, who is one of those people that when you meet her first, you wonder, geez, I wish I'd met her years and years ago. She is a tireless advocate for our community and just really an asset to Cincinnati. The second thank you is to my medical colleagues near and far, from medical students, residents, fellows, and attendings on the front line and in the back, because we've gone through our bench multiple times over this pandemic, and to my Cincinnati Medical Association colleagues and my home and family at UC Health and UC College of Medicine. And then as far as it goes with respect to level setting, this has been a long runway to a discussion on COVID vaccines for many of us, and that has been littered with systemic racism, but also with some very difficult truths around clinical trials. Personally, I bring 3 different perspectives. I am a practicing physician. I graduated from the University of Michigan in 1995. I'm a double alumna, and I practice medicine here in Cincinnati. I also have had the misfortune of having 3 family members who passed away from COVID since this pandemic. The most recent was this week. And the last perspective that I bring is that I am a participant in the Moderna trial. I've had 2 of either normal saline vaccines or the actual vaccine itself. And so I'm grateful. I woke up this morning and my husband was playing Glory by Common and John Legend, and the statement that one day when the war is over was something that brings hope, and I'm looking forward to things looking brighter this time next year. Thank you for having me.
Thank you. That's very encouraging. And I know a lot of people want to ask you about the vaccine because a lot of people are really afraid to take it. Some are anxious to take it. So the fact that you're taking it or in the trial really, is something we can all talk about. So thank you for that. So next, let's have our NAACP President-elect, Joe Mallory.
Thank you, Councilwoman Jan Michelle McKerney. I
just love when people say my whole name. You and Tropicana. Thank you.
Thank you for the opportunity. NAACP has been a partner from the beginning with these community series, and I am glad to be a part of it. And I consider myself a community advocate, freedom fighter, a soldier for justice, and fighting against any kind of injustice. And I believe that the people should have a voice and that we should always be at the table to level that playing field, and that the people feel like there is that hope that there can be change. We've learned a lot during this pandemic with this terminology when we talk about comorbidities, the health disparities, and the social determinants when it comes to health, and the racial polarization that has taken place, and which caused this fear and mistrust when it comes to the Black community getting the vaccine. So hopefully we can dispel a lot of those myths and move our community forward, so we can have some deep engagement and education to dispel a lot of those myths and create some trust, because it's going to be a life-saving measure when it comes to this global pandemic. Thank you for the opportunity.
Okay, thank you. Okay, next let's have former state rep Christy Bryant Kuhns, who is just a real leader here in Cincinnati, and we're so lucky to have her. Christy.
Thank you. Good afternoon, everyone. So from a COVID-19 perspective, during my day job, I work really closely with lots of community organizations, some of which are represented on the call, with the Center for Closing the Health Gap and the Cincinnati NAACP, the Urban League, Santa Maria, SUCASA, and so many others, Avondale Development Corporation. Joined forces with Dr. Monica Mitchell at Children's Hospital to really laser focus on the disproportionate impact of COVID-19 on our communities. And so in my community relations role at UC Health, partnering with Children's, we've been meeting regularly with those stakeholders to make sure that they have all the resources necessary to get the word out to the grassroots community. Sometimes we have these marketing campaigns and slogans and things like that, but they really don't get to the folks on the ground. And so that's been our purpose, particularly in some of the neighborhoods in the beginning of the pandemic where we saw the spike so dramatically, like Avondale and Price Hill. So that's part of it. And then obviously being a former state representative, paying attention to how the politics has played out in this and making sure that we're connected with our leaders. I mean, we're fortunate to be represented by great folks like Representative Ingram and Representative Denson, who fight every day despite being outnumbered, and led by Leader Sykes. We know that it's tough going up there every day with folks who refuse to wear masks and things of that nature, as we're trying to have the community stay focused. And so we just really appreciate you all going to the front lines on that for us. And then obviously my colleague, Dr. Edje, who despite coming to Cincinnati for such a short time has already had such a profound impact in her role, both at the College of Medicine at UC Health and in the community with the Cincinnati Medical Association. So this is just a great panel. I'm happy to be here and happy to be on the front lines with all of you.
Thank you so much. Yeah, there I just, I cannot wait to get started with questions and just hearing more. All of you have just, you've just touched on so many different subjects. Let's start with our opening statement from our Ohio Minority Leader, Representative Emilia Sykes.
Thank you. Thank you so much, Councilwoman, for that introduction. And thank you for having me here today, letting me infiltrate a Cincinnati meeting all the way from Akron. Welcome. I represent the Ohio's 34th House District, which is right behind Representative Denson's, but I'm way up north. So that should just go ahead and tell you how things are set up here in the state, if you just even think about how we number the districts. But not from the Shrew 32 or the Fighting 33rd. I am from the birthplace of champions. You may know a guy named LeBron James. You may know a guy named Steph Curry. You may know Larry Nance Jr. They are all born in, somehow raised a bit, at least born in House District 34. And so I'm honored to bring a little perspective from Northeast Ohio and the champions who are not only basketball superstars, but champions in their own rights, whether it's for workers, for the environment, for voter rights, for freedom, for fairness. That is House District 34. So I'm honored to represent my hometown and bring some of our perspective to you down here in Cincinnati. I also want to bring you greetings on behalf of the Ohio House Democratic Caucus, where I serve as the leader of a really phenomenal group of 38 members. And as we're talking about elections and what happened, things did not go well in Ohio or like we want them to. So we will have a few less members next cycle, but nonetheless just as strong and as shrewd, and we'll still fight the good fight every single day because that's what we do best. So I will be brief because I want to hear from my colleagues and President-elect, as well as my good friend, Christy Coons, who I'm always happy to see again. And I know you all want to hear from them as well, but just let me say a couple things. And Dr. Edje, excuse me, sorry to forget about you. this election was very much marred by the COVID-19 experience. We'll just call it an experience at this point. We've been in the last 9 months trying to figure out how in the heck did we get here? Why are we still here? And what is it going to take to get us out of it? And as we started this process back in March, there was a profound sense of unity in which we, even in the State House, where we often have some knockdown, drag out fights, found common ground to come together, react quickly, and with a common purpose to make sure that this global pandemic did not harm us. Very, very quickly, though, politics got in the way of that. And whether it was the way in which Dr. Acton, a Jewish woman, was allowed to wield her power that was given to her by the state legislature, or whether it was wearing masks, or whether it was the disparate impact on African American communities, on Hispanic communities, on any community of color, it became very clear that those ties that bound us together were much weaker than we thought that they were. And so as we are unfortunately now in month 9 and the health disparities expanding, the economic impacts are exponential, the fact that women are experiencing a she-cession of being the most hardest hit. Our children are not being educated to their fullest potential because they don't have broadband or parents who have the ability to pay attention and teach them through this process, or they're working at the same time too, or there's just stress and despair all over the place. We finally feel like there's that glory that Dr. Edje talked about, the light at the end of the tunnel is coming soon. And we got that through the elections, albeit that road did not go through Ohio. One thing I have talked about often in the election cycle and how we talked about COVID and politics and how it's all intertwined was one day, and Representative Ingram, you'll probably remember this, we were debating one of those voter suppression bills. And they were going back and forth, and we were going back and forth, and the Republicans were telling us about how great this bill was going to streamline this and save money there and make it easier to do this. And at the exact same time, outside, you could hear people chanting Black Lives Matter. The exact same time. So in between the obnoxious conversations of voter suppression, we're hearing Black Lives Matter. But on the inside, the majority of those legislators did not consider Black lives as it referred to COVID, and certainly not for our voting rights. And while we appreciated the opportunity and hearing, I loved hearing Black Lives Matter outside. I knew, and I think Representative Ingram and Rep. Denson knew, that those lives did not matter to the people inside, because those were the same people who refused to even hear testimony on racism as a public health crisis. They didn't want to have the discussion because what they told me was, well, we've already figured that out for y'all. So, we just got a few more bills to pass, and, you ought to stop bullying me. And we're not going to listen to it. Yeah, I rolled everything for that one. Hope y'all caught that. So this is the people, these are the people that we're working with. This is the system in which we were working with. And we were so hopeful that November 3rd, Ohio would say, we don't want people to feel like they have to protest outside. We don't want people to feel like they have to say defund the police because they're being harmed by the police every opportunity that arises. We don't want people to feel like they're being suppressed. And we're going to come up and we're going to show out and we're going to vote these people out. But on election night, Trump won with 8 points. And as a Black woman living in this state, it is still personally devastating to think that the people who live in my state like Donald Trump so much. It is personally hard to get over. Now, as a legislator, I get used to it, but personally, it's just a hard pill to swallow. And that excitement and that encouragement that Donald Trump brought with him, it wasn't just with him, it went all the way down the ticket and removed some really great members of our caucus and some in the Senate caucus and local elected officials across the state of Ohio because they were so excited about what Trump had to offer them. It's devastating. And as we think about where we're going and moving forward, and we think about that in the context of COVID, and that racial disparities are an important part of the conversation that is not had enough, that we don't see culturally competent messaging, that we don't see a conversation about vaccinations, that even in the plan that we saw from the governor on Friday, it excluded people in prisons, although it included lots of other people in congregate settings. We in Ohio are in a very, very challenging place, and one that I don't have the answer to myself. But I often feel like I'm the Debbie Downer and I have nothing but negative things to say. But I'm gonna end on a positive note for once, because the other part of this election is it was historic. We saw Kamala Harris, my sorority sister, ascend, and we will see her ascend to the second highest office in the land, in the world, quite frankly, as Vice President of the United States of America. And I am proud, I am excited, I am elated to be able to see myself in her. So we could see Chloe in her, we could see all kinds of young Black girls and non-Black girls who can look at the future vice president of the United States and say, that should be me, that we belong here in all these places and spaces where decisions are being made. And we also talked about how this was the 100th anniversary of the right to vote for women, with an asterisk. Because even as we talked about that around the State House, there were so many people who were getting up and this is so great for women, and women got the right to vote. But I remember a conversation where I wore a pin that says, "Ain't I a woman?" And the Speaker of the House said, "Why are you wearing that pin? What does that mean?" And I said, well, because 100 years ago when women got the right to vote, it didn't include Black women or Native women or Asian women or Hispanic women. And they said, what do you mean? Women got the right to vote 100 years ago. And so we had to go through the whole story. And so I'm going to end with a quote, because I always like to talk about Sojourner Truth, because in 1851, she gave her Ain't I Woman speech in the birthplace of champions, my home district in Akron, Ohio. And considering that we are now excited about the prospect of Black women who have, for the 100,000 millionth time, saved this country, she said these words in 1851, and I think that they ring very, very true here, and it is exactly what we saw happen with Black women across this country who saved us. She said, "If the first woman God ever made was strong enough to turn the world upside down, these women together ought to be able to turn it back and get it right side up again." And so that's also what we saw in this election in November 3rd. So with that, I look forward to this conversation, look forward to talking with you all, and thank you again so much for having me.
Thank you so much. I just feel like standing up and cheering. Just, that was great information. And I love the quote. And, and when you started talking about, we have an elected official who didn't realize that women of color didn't have the right to vote 100 years ago. I'm shaking my head at that. That's amazing to me, but okay. All right. So it's always a matter of educating people. But listen, we've got a few questions that are coming up, and I know the folks out there are really anxious to get going. So let me just go with the first question that popped up. Anyone can answer it. Why won't President Trump concede? We've been through courts and courts and courts. We've had vote counts. Why won't he concede? What is going on? Who wants to comment on that?
No one is in the mind of President Trump. So I think that's why we're all silent. I mean, what do you mean why I want to concede? It's Donald Trump. This should not be shocking. I mean, I understand the point, but here's what's most important. The country is going to concede for him when the electoral votes come in, and that's it. Doesn't matter whether he concedes or not. There is nothing in the Constitution or in any law that requires him to concede in order for Joe Biden to take his rightful place as president of the United States. So I would spend a lot less time on wondering about whether or not he's going to concede, and just focus on the fact that we conceded for him on November 3rd, and that will go into place on January 20th. And it will become official once the electors do their job here in the next week or so, and it'll be a moot point. Will he make a lot of noise? Will he cause problems? Of course he will, because he's never put the country before himself, and I don't expect that he would begin to do so now, especially when he has nothing to lose, again, because he's already lost. But that's just my perspective, that it doesn't matter because we don't have to have his concession.
All right. Okay. And another question, why are Republicans trying to impeach Governor DeWine over his approach to limiting the spread of COVID-19 in Ohio?
Well, I'll take that one. There's a couple ways I can answer it. And the first thing that came to mind was, it's just something wrong with them. But the reality is they are unhappy with the fact that they have to be minorly inconvenienced to save my life. And again, when we go back to talking about what lives actually matter, do Black lives matter to members of the General Assembly, to our government friends all over the place? And when we ask you to make a simple favor, like staying at home for a little bit, maybe don't go to dinner, put on a mask, it's just not important enough. And so essentially they've made it into a fight about who has the power to make these types of decisions, that this is not about, one of my colleagues said on the floor, this is not about wearing a mask or the science or the doctors and medical experts, is about separation of powers. None of that is true. You know, the legislature gave the health department, the health director, certain rights to be able to be nimble and agile in a public health emergency. This is a public health emergency we have not seen in any of our lifetimes. And having those decisions, as Rep. Ingram mentioned, go through an administrative agency is absurd. The particular one she's talking about, JCAR, the Joint Commission on Agency Rule and Review, is typically made up of lawyers. And I don't have anything against lawyers. I'm a lawyer. We're great. But I also have a public health degree. And I know what I learned in public health school. And I know what I learned in law school. And there's nothing that I learned in law school that would help me make decisions during a global pandemic. Nonetheless, that is what our colleagues are trying to do in order to open the state back up. And I think it's no coincidence that once we started figuring out that our essential workers, our grocery store workers, our janitorial services were the ones who were going to continue to work and serve those of us who had the luxury of being at home in front of Zoom videos, and that Black and brown people were getting sicker and dying, all of a sudden it was like, oh, well, that's fine. We just go ahead and open back up again. And I don't think there's any coincidence about that whatsoever. And it's troubling, but nonetheless, we're going to be dealing with maybe a veto override. But the irony of that is there's so many Republicans who continue to get COVID that they may not even be able to get their numbers to override the veto. I don't even know if they understand how that's silly it's going to look, but it might happen. But that's where we are, and we're continuing to push back on that because there's just some really basic things that need to occur that the legislature is not equipped to handle, that the health director, under most circumstances, although now we have another lawyer, would be best to deal with. And that is the way that it makes sense. But for people who are power hungry and not totally concerned about the entire state of Ohio and all of the hues that come with it, you get that fighting, and now they want to impeach the governor. It's quite absurd.
Yeah, that whole thing about, we know that politics are all mixed up with this COVID thing, but that's the thing. I mean, I love the way you said at first everybody was pulling together, but then politics got into it, and people are dying and folks are out there, worrying about politics. Someone just put in the chat that they heard that Representative Carfanga, I'm not sure who that is, but attended House committees and a session with COVID-19, and they wondered if any of you all knew about that up there in the State House.
No, the interesting thing is, go ahead.
Just to dovetail off of Emilia Sykes' answer, from the physician standpoint, having a health director who was a physician was critical. I think that there was a certain bravery in shutting Ohio down at the very beginning. And really, science is how we roll, essentially. And we wanted to make sure that our hospitals were not overwhelmed, as there is a potential to happen in the next few weeks here. And we were successful in flattening our April curve significantly. And what that did was it bought us time to get PPE, to understand what the demographics within our healthcare ecosystems needed to be, to really face this third surge with additional tools in our toolbox.
Thanks, Dr. Edje. We're going to get back to politics in just a minute, and I know Tropicana wants to jump in here with some questions too. But Dr. Edje, since you've got the floor at this point, I just want to ask you about taking the vaccine and what made you comfortable getting into the trial for the vaccine, for the COVID vaccine.
So if there's anything about Dr. Edje, she does her homework, and especially if something's going to go in my body, you better believe I'm going to do that. So I did a lot of reading on all of the different modalities that were coming to the fore, and specifically the different kinds of vaccines. The mRNA vaccines, which would be largely Pfizer and Moderna, were the two that I honed in right away because they did not involve any virus entering my body at all. What they did would be to ramp my immune system up so that it would recognize the virus if it ever entered my body in a disease state. And so that off the top was a conversation starter for me. The fact that the vaccine was at my institution and really the convenience of that was significant for me. I trust the primary investigator, Dr. Carl Fichtenbaum, with my life. He's an amazing physician and read through everything. I had a death in my family prior. My mother, stepmother, passed away. And that was one thing that propelled me to go ahead and make sure that I was a part of the solution to this pandemic. Again, I've had both of the shots, whether they are normal saline or the vaccine itself. And the second vaccination left my arm feeling like lead. So hopefully I did get the vaccine, but it was short-lived and really not a reflection of anything that was injected into me, but more a reflection of how my body responded, building the blocks and the army that needed to have. So when I do actually see the real thing, it has every tool again in the box ready to fight this. So that was the rationale for it. Again, not a stitch, not an iota of the virus is in my system. And that would never happen if anyone got the Moderna vaccine.
Okay, that's very reassuring. Tropicana, jump right in.
I swear, I think I just heard my child scream. Good afternoon. Dr. Edje, I have a couple of questions that are concerns. A lot of times I like to have opportunities for my listeners, 18 to 34, to get the questions out that they don't understand or they would like to know. I'm on a call, baby. Sorry, guys. Oh, I'm so sorry.
That's all right. I've got a baby too. She's 22.
He was quiet this entire time. He heard me talking. Our first question.
Okay. We would love to see him. He's such a cutie pie. Bring him on anytime.
Go. That was not an invitation today. Dr. Edje, in regards to the vaccine, one of the things that we see a lot on social media is the post that is questioning the ability to be able to trust it. One of the ones I actually saw yesterday, I screenshot it so that I could share it, was that they have not found a cure to cancer. There has not been a cure to HIV. How do we know that something developed in such a short period of time is something that we can trust? So that was one thing that I would like for you to speak to.
Absolutely. Thank you. That is a phenomenally excellent question. So a couple of things. The trial has been going on for a year. However, vaccine development started way back. In fact, we have 20 years of a runway toward coronaviruses. So we have been doing solid NIH research for 20 years. We already knew that it would be the outside of this virus that we needed to look at. Back when we tried to determine what the AIDS virus looked like, the HIV virus, it took us 2 years to figure out and map the genome of that virus. Then it took 2 weeks, speeding ahead to some of the most recent viruses. This was a very short runway. We already had all the building blocks ready to go, and we just had to identify the spike protein, for example, that's on the outside of the virus. And it was a matter of days once that was identified that the virus, the vaccine itself was actually able to be built. So this has not been a 1-year trial from the standpoint of start to end. This has been 20 years in the coming, and we just had to put the icing on the cake for this particular SARS-CoV-2 virus specifically.
Okay, in that same vein, one thing that I deal with a lot is having to fight misinformation. I have an entire war against misinformation, and a lot of it is because thank you guys for all going to school and getting your degrees and your licenses to do what you do. However, social media makes us all experts. So if I see it on social media, it's a fact, and I call up my friends. So some of the things that we're also hearing as well, or conversation from our Facebook doctors, if you put the vaccine or when you take the vaccine, then the virus in your body in order for you to fight it. So what are the side effects? That means that I'm going to actually get sick when I take the vaccine. What's the difference between getting sick from taking the vaccine because I'm putting the virus in my body versus just getting COVID? Can you kind of speak to that?
Absolutely, absolutely. So essentially, what is happening is your body is learning what the virus looks like when you get the vaccine. There is no vaccine, again, that was injected into my body at all, but the mRNA is like a blueprint for the virus. And so that my body is exposed to the blueprint, which is not the virus itself, and is able to build an army of defense against it. And then when I do get that blueprint, as it's building the army, yes, you may actually have your immune system fight you back. And you may actually feel a little fatigue. You may feel some pain in your arm. You may get a small fever, but that is not from the virus itself. That is from your body learning how to fight the virus. And that's the way I'd answer that question. Again, I've had both. Whether it was the saline or whether it was the vaccine, and I have nothing in my body that's virus, not a single particle.
Okay, thank you.
Okay, should we jump back to the questions here? Let's see. So here's a question. Governor DeWine has a better handle on budget balance than some governors. However, drilling down to Cincinnati, is there enough funding to do, as Biden said, go from vaccines to vaccinations? Also, with a history of people of color in government medicine, such as Tuskegee experiments, how is local government instilling faith in the community of the safety and efficacy of the upcoming vaccines? And Dr. Edje, this sounds like something you might have just addressed, but I think people just keep pushing, is it safe? Is it safe? So there you go. Yeah. It's a long question.
I can start that out. Number one, I think the vaccine is actually going to be first taken by healthcare providers and nursing home folks from the CDC side, as well as here in town. So first off, we have 150 or so healthcare workers here in the greater Cincinnati area. What that means is that we have folks who are your next door neighbors who will be taking this vaccine. And quite frankly, they will probably do very well from the standpoint, and you will be able to see them. So I think that's going to be the first telltale sign. People are going to see that people are doing well with it. And I think that's the best proof of anything. We're going to take it first, because we have to, just like on an airplane, put your mask on first for your oxygen tank so you can take care of everybody else around you. And that's why that's going to happen.
And then, the big question that keeps coming up is, when are we going to be out of the woods? I mean, we know everybody, as you said, it's going to be the healthcare workers, first responders, and people in nursing homes because they're living closely together. I don't know when everyone's going to actually get the vaccine, but at what point should we look for, freedom from all of this? Like when do we get to take the mask off? When do we get to stop distancing?
Thank you. That's an excellent question. So a couple of different things. It's estimated that every neighborhood will have to have had 50% of the neighborhood having taken the vaccine for it to burn the other 50% out. Okay, so the thing about it is, has to be the majority of neighborhoods have 50% of their people take the vaccine for it to burn itself out. So you can't have 100% of people in one neighborhood take it and 0% in another. Just like globally, we can't have everyone in the United States, take it and then everyone else outside globally hasn't, because people are going to start to travel. So, again, that is the percentage that we've been looking at, 50% per neighborhood. And again, if we're able to go ahead and get our healthcare workers within their neighborhoods and have their friends see that they're getting it, that may get us to the 50% neighborhood by neighborhood. The next level, apart from congregate living, like nursing homes and physicians and the frontline folks, is going to be those who are over age 65, and also those who have complex medical conditions. So again, that second layer, as we start to see that they are doing well from that, will get us toward that 50% and hopefully burn out the other 50% of the virus in those neighborhoods.
Okay, that's
That
great.
may be a while, not sure on a
Mhm.
date for that.
Okay, yeah. Okay, so we're hoping for this summer, but I don't know if that's too soon. We'll see. So back to our politicians, here's a question for you. Is the legislature going to require people to get the vaccine? Is there talk about that up there in the State House?
Well, you have to recognize this, Rep. Ingram. You have to recognize that there is already quite a movement against vaccinations as it is. I mean, and that's why you have the outbreaks of measles. And I'm no medical doctor, but part of that is an argument about whether or not the legislature should be saying that you do or you do not have to be vaccinated. And so there comes a religious issue. There are all kinds of issues that have been brought up. And so mandating that folks will have to take the vaccine will be very difficult. And it's almost like having to take the flu shot. And Dr. Edje, you can refer to this, taking the flu shot at the hospital. There was an argument about whether or not nurses had to take it or be dismissed or things of that nature. And that's been an argument at the legislative level. And I think that it's important for us to listen to the science, but that's why we've got folks that want to impeach the governor. So it will be difficult to do.
Yeah, science is not an opinion, it's sort of fact. So
Right.
At UC Health, for example, we have a deadline, and if you have not gotten your flu shot by that deadline, your access gets shut off unless you have an exemption, and it needs to be a very solid, rock solid exemption. So because we know for a fact that this does work to keep our workforce and patients safe.
And in Tropicana, you talked about social media and how, everybody's an expert now because they're on social media. So here's a question here, and it says, how are community groups like the NAACP? So Joe Mallory, the president-elect for our local NAACP, this one goes to you. How are community groups like the NAACP helping to combat misinformation on social media?
We have to listen to the experts, and we have to make sure that that information is disseminated to the community. Have listening sessions. This is a great medium right here on Zoom that we have as many as we can, but we have to engage and educate the community and give them all this information, because I'm learning, listen to Dr. Edje, that's some information that I wasn't aware of. So if we start to put this information out there, I think it's more helpful that we can put this information out there and let people, see that this is something that their neighbors, their friends, people that they trust, or listen to the science. Listen to the people who are the experts who are trained in this area, and that if you want to save lives, that, we want to get back to some sense of normalcy, that we have to participate in something like this to protect the community and your family. A lot of us have family members who have comorbidities, they have underlying health conditions, and just a simple exposure is a life and death situation sometimes, because they get hospitalized, placed on a ventilator, and you don't know if they're going to come back from that. And even some of these young folks, you see these young rappers that have come down with it, and this younger generation, they say, wow, this person, for all intents and purposes, seems very, very healthy, but they came down with it, had to fight for their lives to survive. And those are the great spokespeople that say, yeah, this stuff is real, that we need to listen to this and take any kind of measures we can to make sure that we can kind of, deal with this pandemic and put it to bed. I think it's going to take a little while. We may have another year before everybody feels like we're out of the woods, because right now, me personally, I'm not trying to go to any movie theater, and watch a movie even after they start doing the vaccines, because I'm going to be skeptical of what can happen in this closed setting and everybody's close together. The vaccine, I think, is one way out, and that we need to do a better job and do a robust educating session and get on the ground, grassroots, the community leaders, the community council presidents, people who are respected on the ground, grassroots in the communities, give them this information. And I think that they can make some good decisions when they get this information that's an informed decision.
Okay, that's great. Okay, now here's a question from this person is anonymous, but they must be a Democrat, because their question is, how do Democrats increase their representation in the Ohio House, Ohio Senate, and the executive branch? And they said it's been 10 years since Democrats controlled the House. It's been since 1985 since Democrats controlled the Senate. What can be done? How about those districting lines?
I had to take off my NAACP hat and go into my Democratic, operative hat. The gerrymandering that was done.
Mine is NAACP is nonpartisan.
Right.
Center for Closing the Health Gap is nonpartisan too. So just to let everybody know. Okay.
Yeah, we're nonpartisan, but we're not blind.
Okay.
So the things that are happening, in the legislature in Ohio, the reason why you see the whole state turn red, because there's no balance. You create voter apathy when you draw a district that is favoring one party over another. So if you got 70% of the vote, as an opposite party, you have an uphill battle just to have a chance to be competitive. And they've gerrymandered these districts so much and so bad that it's hard to get ahead. It's a shame that when you have a population and you have one party control, when you have a population that may be more of the opposite party, there's something wrong with this picture. When you talk about prison gerrymandering and things like that, people that get counted, just like in slavery, they count the prisoners as population, but they can't vote. And that goes into a district that they count that population for that person's, you have to have 780,000 people in a congressional district. But when they draw it up and they include the prisoners and they draw a lot of, a certain party into a district, then that person doesn't have to listen to the voters. When you don't have to listen to the voters, the people who feel like they're not being heard, they lose hope. They have apathy. They say, it's not going to matter. My vote's not going to count anyway. And if we can redistrict, now that the voters have voted statewide, talking about, fair districts, redistricting, and even some of the ones who are in a safe district, who are in the minority parties, we have to be, realistic and say, hey, we have to look at the entire state and draw fair districts, and make it more, it may not be realistic to do 50-50, but close to being where it's balanced, where people feel like a legislator has to listen to their colleague because, hey, if I need support on my legislation, I got to go reach across the aisle and listen to this person. But if you feel like I'm safe, I don't have to come to the community, I don't have to do a town hall, I don't have to listen to them, that creates voter apathy. And then we try to encourage people and tell them why they need to get involved in the process. That's when you're beating your head up against the wall, trying to get them to understand how policy impacts their lives. And they don't believe it because they don't see change. So the districts being redrawn is the hope that we can have real change in policy.
Okay, and then following up on that, someone's asking the question, does anyone have any advice for first-time voters? And I would add to that, people who just aren't voting at all. They're just out of the process and they've just kind of given up. What kind of message do you have?
Well, one thing is we have to do a better job at engaging, more civic engagement. A lot of people don't understand the three branches of government. When I was growing up, we had stuff like little cartoons called Schoolhouse Rock, where you understand how a bill becomes a law and how the process works. We have to be able to educate on a basic level and explain to people how you can be involved by creating policy. And this is how it's done. So you teach somebody how to fish instead of keep giving them the fish. You teach them how to fish and how to do the process. And you teach them how to engage their elected official, how to lobby them. And when they have concerns in their community, when they see that they can get their needs met, they start believing again. So the education on the grassroots level, that's where we got to go and show people how policy impacts their lives. So if you say, hey, you don't believe in this, but your grandmother's got health care because of the Affordable Care Act. So if they got rid of that, this shows you right there that one person can make a difference. And if you participate, you can make sure that that's protected. And look at the Civil Rights, the Voting Rights Act, when they had a Supreme Court decision where they got rid of the the formula. You know, Section 4 and Section 5 of the Voting Rights Act, you know, when they did that, that weakened it. And as soon as they introduced that, they had a run on voter suppression bills that made it harder for people to participate in this process. So grassroots, engaging and educating on the basic level, it starts there.
Yeah, and I think with that Section 4 and 5, I think it seems like a lot of people just kind of miss that. I mean, that was huge, and I don't know that it really got enough attention. But then in places, I don't know, Texas was like a big example because they started coming up with these laws. I mean, I'm not surprised. I wouldn't be surprised if they started doing literacy tests again. I mean, crazy stuff just started popping up everywhere. So we've got to do something about that. Okay, anybody else up there want to respond?
I just want to mention that I do have a bill, with a concurrent resolution that we were trying to have, and they didn't even bother to bring it to the floor, that talked about encouraging Congress to put the Section 5 back in, because Section 5 was that whether it was intentional or not, if the consequences of the changes were detrimental to certain groups of people, then it still couldn't be done. And of course, that never got heard, never sent to committee or anything. So this is what we're up against.
Deal with that, and that's all of you. How do you deal with being in the minority and just like not getting any support from your fellow legislators? How does that just
ask the leader how hard that is?
Yeah, and I'm looking right at her here on the screen. Leader Sykes, I'm looking right at your face as I'm talking.
But I'd say one thing about it. It is challenging. We have good ideas, we have science, we have facts, and they completely ignore our cries. Not even just necessarily what we say as legislators, but it's what our constituents are telling us that need to be done, and it's frustrating. But I will say one thing, especially about our OLBC members, our Ohio Legislative Black Caucus members. We always have this strategic advantage that most people don't really think it is one, because we have been minorities our whole life. So when we come into the legislature and we are a part of the minority caucus, where it doesn't matter how good your idea is, how smart you are, they don't have to listen to you and they won't listen to you. But we've been navigating that our entire lives. And so when we walk into the State House and some of our colleagues are shocked about the fact that how could they not listen to us? We just look at them like, well, let me tell you more. And I found that many of our colleagues, including Rep. Denson and Ingram and Christy Kuhns when she was there, were very successful in many of their fights, although not on all of them, because we are unfortunately used to being treated like this when we leave the State House. We don't get the benefit of when we walk out the State House, we get to enjoy that majority status where people don't look at us like we're suspicious or we're about to steal something or like we don't look like we belong there, which is something that they've said to me and I'm sure to others in their face. So, we just keep trying. And, the unfortunate part about it is we always hope during the elections we can get a few more people so we can get closer to it. But as President-elect Mallory said, the gerrymandering and the way that the districts are drawn really inhibit the ability for people to want to participate and engage, because like I started off with my opening statement, they could be literally outside the State House chanting Black Lives Matter while we vote on a voter suppression bill that's going to impact Black lives. And these people in these positions know they just need to wait us out a little bit longer. They'll stop chanting outside and they'll just go on back to business as usual. And so part of all of that is just what the NAACP often does is year round talking about these issues, what Closing the Health Gap is doing, continuing these conversations about what matters most to people and reminding, and what we need to do as politicians and elected officials, reminding them that we work for them. So when election time comes back around, they know exactly, yep, I need to circle the bubble for Rep. Denson, I need to circle the bubble for Rep. Ingram, and there's no question about who is actually working for them in their best interests. And so that information and being able to tell that story, because the disconnect in our communities is very real, and we're seeing it as it relates to who represents us in these many different places and spaces. And but I'm hopeful. I'm still hopeful for it.
All right. You know, we're getting so close to the end that I want to give everybody a chance, including my co-host Tropicana, to weigh in and just, you know, give us a message that you want to make sure we get before we have to end this program. And I just want to remind everybody listening that we are going to talk more about vaccines next week. So I know there are a lot more questions coming up about vaccines. Are they safe? Should we take them? What's going to happen? When do we get them? We are going to really delve into that. Oh, there's somebody cute up there with Representative Denson. We are going to delve into that next week. So don't worry about that. We've got you covered. But panelists, just, you know, you can just unmute. You know, come on in. You know, give us your you know, your final thought for today, because we just don't want to close out without you getting to say like that one thing that you want to make sure you tell us.
I'll jump
Let's
in
say
real
real quickly.
Okay.
I'll jump in real quick and just say it's been a good conversation. One of the things to kind of piggyback off of what Leader Sykes said is when some of these things are going on, with sometimes and a lot of times makes things a lot easier for us to fight the fights that we're fighting at the State House, is groups like the NAACP and others coming up and testifying or submitting written testimony, having that different perspective of voices being involved and things going through the process is extremely important. And I've noticed that a lot of people may not realize that it's there. So as a part of that civic engagement, that's something else that is healthy to push out. I know President-elect Mallory, he came up to testify on the bill, and I think he waited around all day to testify on that bill, but I have to say it was one of the most impactful testimonies that was given. And you could even see some of the things you were saying, because you were an expert on the subject, that some folks on the other side of the aisle were just kind of tripped up in it, because it wasn't just their colleagues saying the same thing. It was someone who actually had worked at a board of elections talking about voting issues and all these kind of things. Those things go a long way. So pay attention to what's going on and weigh in. It certainly has an impact. I think these conversations are important to keep happening. I was happy to be a part of it today. Thanks a lot.
Okay, thank you so much.
I want to quickly say that one way that the community can get engaged is there's a survey, the Health Gap, in conjunction with Xavier University and Community Action Agency. There's a survey that they can take. You know, we have it on our NAACP page. Also, there's focus groups that they're gathering, so we can talk about, you know, the things that we discussed today about, you know, is
You're on mute.
Hey, Joe.
Is it safe to take this vaccine? You know, is it something that, you know, we should be concerned about, you know, to dispel all the myths, the fears, and the mistrust, and that they listen to the information, participate with their fears and concerns, and have their questions answered so that we can make some headway into turning this thing around. So participate in the surveys and the focus groups.
Okay, thank you so much. Okay, Christy Bryant Kuhns.
Sure. One of the things I would like to say, there's so much going on in the world right now, and I think that everyone's getting COVID fatigue. And as we get close to the holidays, you know, we've seen the highest number of deaths in our institution than we've seen throughout this pandemic. And, you know, not everyone has the exposure that Dr. Edje and I and others have, where it's not just a news story, it's something we hear on our huddles. There's 3 huddles a day where we're talking about, you know, the state of our hospital, and we're hearing about lives. We're hearing about, you know, these are how many people who's in the numbers from when we started these huddles in March till now. They are the highest I've ever heard. And their mothers and fathers and sisters and brothers and people's children. They're not just, when I hear it, you know, it was 12 or whatever the number is, it's people. And so when you think about Christmas and Hanukkah and all of these other celebrations, Kwanzaa, everything that's coming up over the next few weeks and New Year's, yes, you may miss seeing someone this year, but think about the empty chair that may be there next year because they didn't survive. And if you are a worker, an essential worker who celebrates with your family, and then you go take care of an elderly person at a facility, a long-term care facility, or in their home, you're exposing them. You may survive it, but they may not, and they may not have an opportunity to see their families next year. So please, my plea to you is to please, please, please be careful over this holiday season. This is real. These numbers are going up. They're not going down. Our positivity rates are high. Please be careful. That's how I would like to close.
Okay, thank you so much. Representative Ingram? You're on mute though, okay.
I think I said enough. Skip to the rest of the folks so we can make sure everybody gets in. I just want to make sure that folks understand that we're at the State House working hard for them. So as Rep. Denson alluded to, check on what's happening. And this census is not going to be as simple as they think. So not the census, but when the count actually comes in, redistricting will not be as simple as they think. And of course, that's going to be done in this next GA. So thanks.
Yeah, we will have to have a whole town meeting on that. That's going to be, yeah, it's going to be quite a challenge. Dr. Edje.
Two things. Number one, before you say no for your family or yourself, reach out and ask a question. I am happy, more than happy to be a resource. There's not a single stupid question. And I do understand. I do understand the history. I understand that deeply. Also, the second thing regarding holiday gatherings, the youngest in my family is 2 years old. My youngest patient with the COVID is 7 months old.
Oh.
My grandmother turned 97 this week. The closest person who I love is in this house that I'm in right now, and the farthest is 9,000 miles away. We are not getting together in person, but we are getting together via Zoom with all the trappings and festive music and everything else, so that we will have another day where we can hug each other tight and hard after COVID is done. It's not worth it to risk a turkey or a hug now. Save it for later.
Save it for later. Okay. We're going to close out with Tropicana, who's going to bring on Renee.
Okay, I just want to say thank you to everybody who participated in the panel today. Dr. Edje, thank you for even being brave enough to take that vaccine and to come on and be the change that we need to see. We need to not be afraid of taking the vaccine. And it's great to see not only are you practicing medicine, but you are also showing us through your lifestyle and your choices that it's safe and this is the great direction. So thank you for your service. All of our leaders online, thank you guys so much for what you have done. I'm so excited to see the works that you guys will be able to get done this year. And my prayer is that with all the discord and disconnect that we have seen coming from the top and between the political parties and the minority and the majority, pray that there will be some level of peace or some place where we can get together. I don't even know what the word is, but somewhere where we can get to a place with, even with our disagreements and our differences, we can find a place where we can meet in the middle. So I commend you guys for your work, and I'll be praying God's strength and peace because y'all gonna need it with the people that y'all are working with, but we appreciate your work. And as always, Miss Jan Michelle Lemon-Kearney, love your last name. Love it. Thank you so much. You are amazing. And with no further ado, a very big thank you to our president and our head honcho, Miss Renee Mahaffey-Harris.
Okay, well, it is Renee. And first of all, I want to say thank you to our minority leader, Sykes. Thank you to Dr. Edje. Thank you to Christy Kuhns, our former representative and leader at UC Health. Thank you for our president-elect, Joe Mallory. And thank you to our representatives, Denson and Ingram, for joining us today in this conversation. The time goes fast. I think the word that I would say, Tropicana, is grace. We must give each other grace during this time. I know that you at the State House are dealing with folks who, just may see it from a different perspective. And at the end of the day, we want to save our lives. And so I thank all of you. I thank you for the work that you do at the State House. And I know that we are going to have continued conversations. Joe, thank you for mentioning the survey and focus groups. We have been asked by Hamilton County to do a series of focus groups, as well as support groups, as well as quantitative surveys, so that we could better understand the impact of COVID-19. What will be at the end of that information that we will gathering, which is just a starting point, is we're going to build a message that we'll continue to build upon that helps us be able to save our lives and the lives of Black and Brown people in this region, and frankly in this state. And so we have a lot of work to do. We are going to be hosting town halls up until the Christmas holiday. And next week, we're going to have physicians on talking about the vaccine. And we invite you back to come on to ask all the questions possible. We must continue to inform ourselves with knowledge and information so that we can really dismiss some of the myths. But we know those myths are going to be out there. They are out there. I'm guilty of listening to some of them over my years of life. So together, we are going to save the lives of Black and Brown people in our city and in our state. And I thank you all for being here today. And I pray that you continue to mask up, social distance, and wash your hands. We are in control of how we care for each other by taking care of ourselves and saving the life of someone else by doing those three things. So thank you all. You all have a blessed weekend and look forward to our continued work together.
Thank you.
Thank you.
Thanks, everybody.
Michelle.
See you next week.
Anna.